Hi all. I see people are starting to file in from the waiting room. Before we get started, I just want to mention that ASL interpretation is available for this session. In order to view the ASL interpretation, please pin the video of Karen Holland in the participant panel. You can do this by right-clicking her video and selecting pin. Thank you so much to Karen for providing the ASL interpretation for this session, and I'll go ahead and paste this information in the chat for anyone who is deaf or hard of hearing. So just a couple of seconds for that. Actually, I don't think I can use the chat. So Chelsea, if you can put this information in the chat, and
Will do, Charlie. Go ahead.
I'll make sure to repost it a couple of minutes into the session. Good morning. Thank you for joining us for Tipping Point, Connecticut's first affordable housing conference series. My name is Charlie Shaddix. I'm the communications manager at the Partnership for Strong Communities. Throughout the week, we're hosting over 30 sessions featuring local, state, and national experts leading conversations that explore challenges, share best practices, and coalesce us around critical next steps to address key affordable housing issues in our state. This session is titled, We Want to Be Your Neighbors, Obstacles Faced by People with Disabilities When Moving into New Communities. As many of you know, accessibility is a huge issue in housing. At the Partnership, we talk a lot about housing choice, or people's ability to find an affordable housing option that works for what they need. For people with disabilities, this lack of choice is even more pronounced. This panel will explore some of the issues faced by people with disabilities in finding housing that truly integrates them into the community of their choice. Before we turn it over to our presenters, oh, sorry, this is the title slide. Before we turn it over to our presenters, we would like to thank our leading sponsors, the Connecticut Housing Finance Authority and the Melville Charitable Trust. Their deep support has allowed this conference series to exist. We would also like to thank our collaborating sponsor, the Connecticut Department of Housing, and our supporting sponsors, Housing Enterprises Incorporated and Whittlesey. Before we get started, just a few housekeeping notes. This session is being recorded, and we will make all recordings available to conference attendees as soon as possible. All participants have entered muted. Please remain on mute unless a presenter has asked you to unmute. If you have a technology issue, please select the chat icon in the control panel and send it in the chat to myself or to Chelsea Ross. We will do our best to assist you. Your presenters will let you know how they would like content questions to be submitted, and a few minutes before the end of the session, we will launch a poll that asks for your feedback on the session. Please take a minute to share and help us improve future webinars and conference offerings. Lastly, the Partnership for Strong Communities is working to better understand the needs of our communities and affordable housing partners. Towards the end of the session, we will be sharing a link to a survey in the chat. Please take a few minutes after the session to share your feedback and help shape both the issues we work on and the ways we work. I will now turn it over to our presenters to get us started.
Thank you very much. This is Erin Kemple, and I'm going to take a moment to put up our PowerPoint, and I ask that you just bear with me while we get everything. So thank you very much. The people who are going to be presenting today are myself, Erin Kemple, who is the Executive Director of the Connecticut Fair Housing Center, Eileen Healy, who is the Executive Director of Independence Northwest, Regina Dyton, who unfortunately can't be with us today because we just learned she was admitted to the hospital, and finally, Kathy Flaherty, who is the Executive Director of the Connecticut Legal Rights Project. One of the things that we really want to point out here, especially at the beginning, is that the goals of the Fair Housing and the Americans with Disabilities Act laws are to promote integration so that all neighborhoods welcome all people, to prevent discrimination so that people are not prevented from getting access to the housing of their choice, and finally, to ensure that rules and policies do not result in excluding people in the protected classes from the housing of their choice. Unfortunately, what we have found more than 50 years after the passage of the Fair Housing Act and close to 40 years after the passage of the Americans with Disabilities Act, is that we're doing a very good job, or a pretty good job at stopping individual acts of discrimination. In addition, disabilities rights groups and their allies have worked very hard to ensure that federal, state, and local rules do not result in excluding people from the protected classes from housing. Where I think we need to do a lot more work, and I think what you're going to hear about today, is the last point, which is that we have not succeeded in promoting integration to the extent that it is needed, especially within the disability community. People with disabilities are still overwhelmingly confined to either group housing, where they're living in group homes, even if they don't need it, housing where there are also just people with disabilities, or housed in hospitals and have not been able to move out into the community. Some of the reasons for that there are a lot of reasons for that. Some of it includes a lack of accessible housing. And so one of the things that the Fair Housing Act and the ADA require is that housing and public accommodations be made accessible. But unfortunately, it mostly applies within the housing context to newly built housing. And what we see in Connecticut is rehabbing old spaces or rehabbing housing that was for people without disabilities. And the Fair Housing Act does not require that those units be made accessible. There's also a lack of affordable housing because people who are disabled are unemployed, or most importantly, underemployed. It makes it difficult for them to afford market rate housing. And as a result of that, there is a strong need for affordable housing within the disability community. In addition to that, our zoning codes keep people out of a lot of communities. The Connecticut Fair Housing Center has been doing an investigation of the rules of various zoning codes throughout the state of Connecticut. And whenever someone goes into a zoning office and says, for instance, we want to live together because we know each other, but we also happen to be disabled, the immediate answer is, then you're a group home and you have to get a special permit. Even when the people explain, no, we're not a group home, we're just a group of people who want to live together, the same as if we were a lacrosse team or a group of people who, knew each other from work, the answer is no, because you're disabled, you have to get a special permit. In addition to that, I think one of the things that we're starting to recognize is that communities are very, very afraid of people with disabilities. Current events include many instances of police officers hurting or killing people with disabilities because of the belief that the person is a threat to others, when in fact what is going on is that the person is a threat to themselves. They are having some kind of a psychotic issue, or they're having some other kind of mental health issue. And instead of assisting, we've seen a lot of times where people with disabilities are either hurt or killed by the police. So today what we want to talk about is some of the issues, the specific issues that the people on this panel have encountered when they are trying to assist people in integrating back into the community, either from one community to another or from a residential setting like a hospital back into the community. As I already put into the chat, I will be monitoring the chat because we really want your questions and comments as this panel moves forward. We will address them without waiting until the end. And finally, Karen Holland is the ASL interpreter during this presentation. If you pin her, you will be able to, on your Zoom call, you'll be able to see her throughout the presentation. And now I'm going to start by turning it over to Eileen Healy, who is the Executive Director of Independence Northwest. Independence Northwest is a private agency that assists people with disabilities in all phases of their life, We have worked with Independence Northwest often on the housing issues that their clients sometimes encounter. Go ahead, Eileen.
Thank you, Erin. I want to start first off by telling you I'm a person with dwarfism. And the reason I bring that up is it's going to become apparent when we start to talk about the obstacles that people with disabilities face in terms of their access to apartments, housing, where everything fits. And my goal in this presentation, sorry, I had to move my notes around, is to let people know that there is no one size fits all in terms of accessibility. And when we see individuals who are perhaps moving from nursing facilities under Money Follows the Person to community-based living, they're moving out of their parents' home perhaps for the first time, or they have a home that they've acquired a disability and it's no longer really accessible for them. And we try to figure out ways to make it be as accessible as possible. And that's going to be different for every single person. There is no one basic other than certain kinds of things. Having a ramp on a building, having wide enough doorways. Those are kind of standard things that we need to have for everybody. It helps UPS drivers, it helps parents with strollers, those kinds of things. So what we try to do with individuals is identify the types of apartments, housing. I'm going to reference apartments because that tends to be the biggest area that's accessible or could be made accessible. You have to think about housing. Is it accessible from the inside and outside? Are there parking spaces? Are the parking spaces near the building? Is there an accessible entrance from the parking lot to the apartment, to the entrance of the doorway? Is there an elevator? Is the elevator well maintained? Is the panel at the proper heights? Are there steps? We see a lot of ramps that are beautifully built to code. And then when you get up to the front door, there's a step of about 4 inches. And that obviously causes lots of problems. The width of doorways, the size of the bathroom. If you are a wheelchair user, you need just about 60 inches of turning space to be able to maneuver well in a bathroom. Are there grab bars? Is the toilet at the right height? Are the counters at the right height? Are any of the units in the front door, if it's a multi-unit housing, is there an electric door opener at the front? Could you do one on the actual apartment door? And I've been doing this job for a very long time. And years and years ago, there used to be these huge things called environmental control units that were intended to assist someone with a very severe disability, perhaps somebody with quadriplegia, to be able to control their environment by their voice. We've come a long way in 30-something years. And we have things like Alexa and Google and all of these other programs that work incredibly well as long as you can afford internet. And that's where things start to get a little screwy. I also want to talk about some of the other disability groups. People who are deaf, flashing doorbells, fire alarms, people with visual disabilities, as their braille or raised tactile markings in elevators or in common areas of their apartment. And the other thing I want to talk about in terms of accessibility that I don't think we always take into consideration is location of the apartment or housing. A lot of times individuals we've seen move from a nursing facility into the community, but there's no nearby public transit. They don't have a vehicle. Is there a local grocery store that they can easily get to? Can they access their medical professionals? Creating a world where people can access the community also helps them to better integrate into the community and makes the community more welcoming. So those are the kinds of accessibility factors. I really encourage people that work with individuals to address and identify housing. Is number one is to know what the standard codes are for accessibility. And then even more importantly, talk with the individual. As I said in the beginning, my disability is not helped by a raised toilet or higher counters. It's a problem for me. So you really need to take into consideration each individual, what their strengths are, what their preferences are, and trying to figure out ways to make that accessible, make it comfortable. I would encourage anybody that needs information about how to do that, what the codes are, suggestions, to feel free to contact me, contact one of the other independent living centers in the state. We all work with individuals on helping them to modify. And in a lot of cases, there are things that we can modify that don't require huge amounts of dollars, and may be unique. For example, I don't know if any of you know what a dandelion picker is. It's a tool, it's got a little V on the end of it. And it is used obviously for digging up dandelions from your yard. But what I've done for curtain rods and clothing rods is I use that to take hangers off and put them back on an upper rod. So you find things that work really well. Now that works for me. It may not work well for somebody who has grip issues, strength issues in their arms. So trying to figure out what it is that someone may need and assisting them to figure out things change over time. One of the things that I really strongly believe in is planning for aging in place. It is what people really want to stay in their own homes. They don't want to have to go to a nursing facility because they can no longer stay in their home because it's not accessible. Identifying units that can be easily made accessible or not. Sometimes they just need massive amounts of modifications, and that creates another issue. So those are the things that I would recommend in terms of access and having people involved in that decision as to where they want to live, why they want to live there, and how to make a unit work for that individual.
Eileen, before we move on to Kathy, or before you wrap up, I'm wondering if you have any examples of some of the things that your agency has been able to do where a landlord, for instance, is saying to people, saying to someone with a disability, well, I want a letter from your doctor that says that it's okay for you to live here, or I want you to prove to me that you can live independently. Have you seen that? And if so, what are some of the ways that you've tried to address that?
We haven't seen a lot of that. We did have a situation in the Torrington area. It was a number of years ago now. It was a condo association, and the child didn't have a disability, but the mother did. And she was saying, why can't the school bus, it's a smaller bus, not a great big one, come into the condo parking lot to pick up her child so that she didn't have to go all the way out to the end of the entrance. And they said, oh, no, we can't do that. And we said, oh, yes, you can. And it took a while. It took going to condo association board meetings with the individual, with one of our advocates to say, this is not acceptable. I think if you're a person with a disability that doesn't know a lot about your disability rights, it's very easy to hear somebody say, here's what you need to give me, and you go do it. But that's not the way it works. And we work to educate people to say, that's not required. You don't have to do that, nor should you. And there are other situations where sometimes it becomes, you kind of need it. We had a situation for an emotional support animal in a no pets allowed apartment. And we said, okay, they need proof to show that this is really what is needed. And in fact, everybody was okay with that. And the individual did get to keep the support animal. So I think we also take the approach as independent living centers and disability advocacy organizations of working with individuals on what their needs are. It's all individualized. So there's no one right thing to do. It fluctuates based on an individual's needs. And before I go on, I do want to talk a little bit about affordability, because that's the other problem besides access. And access is also somewhat dependent on being able to afford things. In a lot of cases, you can find an apartment, you can say, this would be perfect for me with X modifications, and you can't afford those modifications. You may be able to afford the ongoing rent, but not the upfront modifications. There are issues around zoning. As Erin was mentioning, even if you want to put a ramp up on your property, certain areas have zoning rules about having to get an approval process for that. We run into individuals low income. They haven't worked, or perhaps they lost their job, or they've been into a foreclosure or a bankruptcy, perhaps because of acquiring a disability. They've got poor credit. We have instances where we've had individuals with a history of criminal background that even goes back 20 years, and everything has been great since then, but it crops back up. Those things also impact individuals with disabilities and their ability to have an affordable community-based apartment. Sometimes we argue with both the feds and landlords about giving a 2-bedroom apartment to an individual because they may need a live-in personal assistant or an overnight. There is a reason for that. And how you get around some of those regulations becomes important. Many years ago, we as a community disability rights folks had an option to pass some legislation that was universal design as opposed to ensuring a number of accessible units. And that's been very controversial. I don't believe it ever passed, really. And there were people that said, no, we need to set aside a certain amount of accessible units. The problem is it's not always accessible for everybody. And adaptable and universal design with those basics, number one, it allows visitors with disabilities to come. You can go visit your other tenants in an apartment building if that was accessible. For people like me or somebody who's blind or somebody who's deaf, putting in those other kinds of accommodations become really important in making it a home for someone. So we've gone back and forth, and just as in any community, people with disabilities are going to disagree on what they think is best, and that's a healthy discussion. But I would encourage everybody to really keep thoughts about how do you make this more adaptable, because in the long run, I think it helps with aging in place. It helps people find apartments and not have to go into such huge expense to make them affordable and accessible for themselves.
Thank you, Eileen.
I think that's it for now.
Yeah, thank you very much. As Eileen was talking, it occurred to me that people with with regards to the protected classes, we all have the chance of becoming someone with a disability. Most of us are not going to wake up tomorrow and be a different race or something along those lines, but any of us could walk out the door and become a person with a disability. And for that reason, it's always surprising to me that our disability rights are not more respected and pushed. And I'd like to now introduce Kathy Flaherty, who is the Executive Director of the Connecticut Legal Rights Project. Many of the issues that Eileen was talking about had to do with physical disability. Kathy's group works a lot with people who have mental disabilities or have both physical and mental disabilities. So go ahead, Kathy.
Erin, you want to move the slides along? So I want to start my presentation. As Erin said, I'm the Executive Director of Connecticut Legal Rights Project, and we represent people who are eligible for mental health services from the Department of Mental Health and Addiction Services, which we refer to as DMHAS, DMHAS. We have been in existence for the last 30 years. We came into existence right after the ADA was passed. We really were incorporated in '88, but formally incorporated in September of 1990. And the ADA celebrated its 30th anniversary on July 26th. So the growth of the ADA and the growth of CLRP really are along the same path. And Erin, I need the slides to move so I can see mine because they're still stuck on Eileen's. So one of the things when Eileen was talking
Kathy,
about the importance,
has it moved ahead?
Thank you.
Yep.
Is that when we talk about assisting people with disabilities, it is so individualized, and we have to remember that we are always talking about people. One of the things that has frustrated me as a lawyer who has a disability is that the case that represents disabled people's freedom from institutions is named for the governor in Georgia who was depriving disabled people of their rights. You hear a lot of talk about the Olmstead case, but I think it's important, especially if you think about the people behind the case. It was all women, which I think is just kind of a cool thing. And this slide shows those women. You have Lois Curtis, who is an African-American woman. Sue Jameson was a legal aid lawyer from Atlanta Legal Aid. And Elaine Wilson is a white disabled woman. Lois was a fantastic artist. The art that you see on the page is art that she drew, including her holding self-portraits and also a portrait she drew of Elaine. She got to visit President Obama and show him and gift him some of her art. And the two professional looking portraits were taken by Tom Olin, who really documented a lot of the disability rights, disability justice movement. And of course, the Supreme Court decision was authored by Justice Ginsburg, and in a lot of the tributes to her and her fantastic work on the court, the tributes that talked about her work in writing Olmstead were tributes that came from people with disabilities. Mainstream coverage did not talk a lot about Olmstead, but fortunately, more people with disabilities are raising their voices and really called out the work she did that helped to change a lot of people's minds about what opportunities should be made available to people with disabilities. Next slide. So what is Olmstead and what is what we call the community integration mandate? The Supreme Court decision was issued in 1999. So we're now 21 years after that decision came out. And the Supreme Court ruled that it is discrimination in violation of the Americans with Disabilities Act to require a person to be segregated or institutionalized in order to get services when they could be receiving services in a less restrictive setting. And the court emphasized that Congress, when they passed the ADA, had the intent of using it to secure opportunities to live in the community for people with disabilities. And the court also did note that institutional services had to continue to be available for people who do require that level of care. Next slide. It doesn't guarantee that everyone gets discharged. I think everybody who works within the disability rights field wishes if only that were actually true. It's not. The ruling does not come with money, which is always a consideration, and states can consider the availability of resources, as well as the fact that people with disabilities have very different needs. The decision does not require that hospitals be closed. It does not require immediate deinstitutionalization, but it says that states have to look at the needs of all people with disabilities. And states were really expected to discharge people from institutional settings at a reasonable pace. If you think about other civil rights decisions going back to Brown versus Board, all deliberate speed. They do some things more quickly than they do other things. And states are not supposed to be able to say, oh, sorry, we couldn't do it, we don't have the money. That's not a good enough excuse. State's supposed to come up with a plan. Next. We all know, because we've been living through this pandemic since March, that congregate care settings place people with disabilities at a higher risk of contracting COVID-19. One of the things that, again, has been remarkable to me is the lack of attention that the media has paid to one of the recommendations in that multi-million-dollar report from Mathematica. They actually recognized that integrating people with disabilities in the community could help mitigate the spread of COVID-19. Next slide. One of their short-term recommendations to mitigate a second wave. As we all know, being in the middle of it now, short-term recommendation not really followed, but that the Department of Social Services and their various access agencies with which they contract should work with hospitals to facilitate discharge of older adults and people with disabilities with COVID-19 to home and community-based settings rather than nursing homes, with appropriate home health and other supports and care coordination. Next slide. The longer term recommendation to prevent future outbreaks. Of course, as vaccines come, hopefully that will lessen some of the need for this. But I have told people that these are legal rights that exist regardless of COVID, but the same way COVID has really exposed so many other disparities, it's also exposed the failure to get people integrated out of institutions and into the community. Mathematica recommended that the state should ensure that all residents of long-term care facilities get counseling on their options to get services in the community and support those individuals who want to return to the community. That the state should ensure continued support to the various Medicaid programs. Money follows the person, My Community Options, myplacect.org, that help the people who need long-term services and supports either return to or remain in the community if that's their preference. And that the Department of Social Services should make sure that there are enough resources to deliver adequate home and community-based services, enough personal protective equipment, including groceries and medical supplies, to beneficiaries' homes, and prioritize COVID-19 cases. Next slide. This slide is a little meme that I created after conversations with Richard Cho, who's head of the Connecticut Coalition to End Homelessness, because he was talking about how he has drunk the Olmsted Kool-Aid. Community integration is delicious. People with disabilities deserve the opportunity to be part of our communities. And I would encourage you to have some too, and work with us as we try to protect people's rights and support people with disabilities who want to live in the community, be part of all our communities. And that's my contact information for anybody who wants to reach out. You can also find me on Twitter, not this hour, but pretty much any other hour of the day. I do see a question, what is Mathematica? The state of Connecticut, after the first wave of COVID hit, and especially considering the devastation that it wrought on nursing home facilities and assisted living facilities in the state, contracted with this organization, Mathematica, to examine the state's response to COVID. And they wrote a preliminary report and a final report after talking to various stakeholders. And they made recommendations to the state about things that they could do better.
Kathy, can I
Kathy,
jump?
go ahead.
Sorry,
Go ahead,
Erin, I
Eileen.
was just going to
Nope.
jump in, and because I think that a lot of us, as younger adults, perhaps, kind of view it's just older people in nursing facilities, and they wouldn't be in the nursing facility if they didn't have a disability. Okay, because that's how you get funded by Medicaid to get there. So when we talk about people with disabilities being disproportionately impacted by COVID, especially in nursing facilities, they're all people with disabilities of some degree.
So that was actually the point that I wanted Kathy to discuss a little bit with regards to cost and having and support for people living in the communities. My understanding is that the cost is less, and I wonder if either Kathy or Eileen could comment on that.
Sure. This is Kathy. The thing that's very frustrating, and I'm sure Eileen and Erin feel this too, is it really hurts to talk about all of this in terms of financial cost. It is incredibly painful to have to talk about people and people having opportunity based on whether it's cheaper to help them in the community rather than institutions. There's just something so fundamentally wrong about that, except for the fact that it is pretty much the only argument that works with government. And, for representing people who are residing in the state-operated psychiatric inpatient facilities, where it is incredibly expensive to provide care per year. The Department of Mental Health and Addiction Services, the auditors audited the State Department, and it cost upwards of $500,000 a year to keep somebody institutionalized in the state psychiatric hospital. The problem is, if you don't have enough movement in the system, if you don't have enough options in the community, people get stuck in the hospital. You need to have enough movement in the system and a flexible enough system so that you can actually discharge people who are ready to be discharged to the community on a timely basis. It's not only the law, but it's just how you actually make your system work. Because if you don't, you just create these log jams for people. And especially when the log jam is at the state hospital level, you literally are institutionalizing them, you are segregating them, but you're also getting them stuck at the most expensive level of care, especially when it's unnecessary. It's just not, it's not wise.
Erin, could I add to that? That in addition to everything that Kathy has said, which I totally agree with, there's also the problem of, someone once told me it's like righting the ship. You got to get the Queen Mary to turn. And we are not there yet in terms of home and community-based services that keep people out of institutions in the first place. And that's one of the things that I think as a group, as the state, we need to really work on that, because what ends up happening is that people end up in a nursing facility, perhaps because their home is no longer accessible, or they don't have the supports, people supports or other supports. They need to stay in their home. They end up in the nursing facility. They've lost their homes. They've lost their belongings. And now they're going to have to find a new place to live if they want to come back out. If we had figured out a way to be able to support people to stay in their homes, we'd be saving a whole lot of money too.
Erin, you have to unmute yourself.
So I wanted to use that, those two comments as a way to segue into some of the resources that the Connecticut Fair Housing Center has. So as you've heard talk about today, the fair housing laws do prohibit discrimination against people with disabilities in housing. And that means a couple of different things. One is that you can't refuse to rent or sell to someone simply because they're disabled. Some of what we've talked about here today really has to do with landlords or other housing providers just not wanting people with disabilities in their communities. And I know that the independent living centers, especially those who are working on money follows the person, which moves people from nursing homes back into the community, have encountered that. So what you have up on your screen is just the place in our website where you can get an overview of the fair housing laws. But one of the things that both Eileen and Kathy talked about is people needing to have their housing changed, or the rules with regards to their housing changed in order to allow them to live in the housing. In the fair housing field, it's called a reasonable accommodation. And really it's what Eileen was talking about, which is getting a condo association to allow the school bus to drive onto the property, or getting a landlord to agree that someone can have a emotional service animal. If you need a change in a rule, policy, or a practice, we do have a place on our website where you can generate a letter that asks the landlord to make changes, to make your place and the rules with regards to your place conform to what you need as a person with disability. And Eileen also mentioned that people with disabilities sometimes need, for instance, another bedroom or a larger place. Those are both reasonable accommodations, and we have, along with the independent living centers throughout Connecticut, worked hard to ensure that those kinds of reasonable accommodations are made. But as Kathy and Eileen have both said, some of the problems have not yet been resolved. There has not been changes to zoning codes that allows people with disabilities who live together, either in a group setting or just want to live together as people who know and support one another. Those places still have to go through a lot of the zoning appeals, et cetera, that have been in place for years and years. And those prevent people from moving out of the congregate settings that Kathy was referring to and back into the community. In addition to that, just before we began, Eileen and I were talking about a client who needs changes to the physical structure of her unit in order to make it accommodate her physical disability. Unfortunately, private landlords who do not get any money from the federal government do not have to make those changes at their expense. That is up to the tenant to make changes at his or her own expense. And while some of the independent living centers have managed to raise money to assist people in making modifications to their unit, I know from talking with independent living centers that that money goes quickly and it doesn't extend to all of the need that is out there. If you or someone you know has a housing discrimination problem, either with their disability, because of their source of income. Sometimes landlords say we won't rent to you not because of your disability, but because you have are going to pay the rent with a housing subsidy or with assistance from an independent living center. That's illegal. Eileen also mentioned that they have clients often turned down for housing because of a years old criminal record. That may also be illegal discrimination, especially if the criminal record was the result of an addiction that is no longer current or some other disability. And that is something you should also call us about. On the screen, you have both the 800 number for getting in touch, the toll-free number for getting in touch with us, and our intake line. And yes, we are open during the time that during COVID, and we are assisting people as they need it. I'm going to stop sharing my screen now, in part because I want to see if there are any questions or comments. I'm having difficulty seeing the chat feature from that. And if we don't have any, then we'll just end a few minutes early because I'm sure that there are a lot of people moving from one place to another. Kathy?
Erin, there was a question about explaining more about the zoning restrictions that people with disabilities encounter, because at the Center for Independent Living, they build group homes in various communities. And of course, we have that Connecticut Section 8-3E that prohibits zoning discrimination against group homes with 6 or fewer people. But I think, as both you and I know, that there are numerous municipalities in Connecticut who can't seem to understand that that's the law. And I think when Erin, my perspective when Erin mentioned that is that was more like the towns who can't seem to quite get it right and think that they can impose different standards on group homes and smaller congregate settings for people with disabilities, because Diana in the comments absolutely right. 6 or fewer people, they're supposed to use the same rules that they apply to any single family house in town. But we have seen multiple examples of municipalities in this state that can't seem to understand the very clear language of the statute.
Thank you.
Also just clarify, Erin,
Yes.
really quickly, because I think that they're referring to the Corporation for Independent Living in that chat.
You're right.
And they do. They have some dollars that they can assist for individuals to make their units and their homes more accessible as well. It's not necessarily the Centers for Independent Living, but Erin was right earlier that each of the 5 centers in the state do have a small pot of money that can be used to assist individuals to make their apartments, their homes more accessible, or to purchase assistive technology, can even do short-term personal assistance as necessary. And the other thing that I want to get in here before I forget is, number one, don't always assume that somebody is turned down for housing because of their disability. Sometimes it's because of some other characteristic that the person has. We've had a situation in the past where a man who was a person of color and had HIV, they were fine with the HIV. They didn't like that he was a Black person. We went after him and we won that. And then the second thing is, if you're helping people to try to find housing that's affordable, get them on every single open list for Section 8 in the state. And should they get lucky enough for their number to come up and not, 10 years later, get them to look at, especially if they're a person with a disability, for a reasonable accommodation to move it to the town where they want to live. That's one of the biggest strategies that has helped us in the situations where, because those waiting lists are so long. And if you're only putting it in one place, you've limited so much of your options.
So the other thing I just want to point out before we close is that Samantha Van Schoik, and I hope I didn't pronounce that incorrectly in the chat, and she mentions that the CIL where she is working is currently looking for people who qualify for the LFA program, where they have funds right now in order to make modifications. Samantha, if you're still on, you can unmute yourself and go ahead and explain the program.
Sure. Hi. Sorry, my camera's a little foggy right now. CIL administers the Loans and Grants for Accessibility program for the state of Connecticut. And right now we have money available. I don't know exactly how much money we do have available, but I know we are looking for people who qualify for the program. There's more details for the eligibility than, there's a lot of steps for eligibility, which is why it can be kind of challenging to get people through that. But I can give you kind of broad strokes. It's we've done grants between $5,000 to $70,000 for home modifications for folks that make less than the median income in the state and have a disability. So that's like the broad eligibility. But there's more steps to it. But if you have questions or people you can refer to the program, we're like struggling to find people to get through. So, and we want to spend this money. So I just thank you for giving me a chance to talk about it.
And Sam's email is sam@cil.org if you need more information. Charlie or anybody from the PSC, do you have anything to add? I think we're done, and I want to really thank the panelists and thank everyone at the partnership for putting this on. Charlie or anyone else?
Nothing additional to add. Thank you so much for a great presentation. We just put in the chat, we have a link to a survey for strategic planning for our Home Connecticut campaign. But thank you so much for putting this on. I think it is an amazing presentation, and yeah, can't thank you enough.
Thank you all very much for coming. Bye-bye.